Thank you. I'm here at the TED Congress 2024, and I have Jessica Randolph, who just presented at this Co-Pilots in Vascular and Podiatry. How do we save limbs and save lives in a multidisciplinary team? So, Jessica, thank you. Thank you for making
You're
the
very
time to be
welcome.
here at TED Congress 2024. Can you tell me briefly about your career and where you are right now in terms of podiatry and in terms of limb salvage and saving limbs?
Absolutely. I started my career with Dr. Freiberg
We just
as a
had him here.
residency.
Yeah.
I was with him in residency at the Phoenix VA and really got quite an education in limb salvage and an approach to saving limbs and saving lives. After graduating residency, I stayed here in the Valley. I'm a Phoenician. So I am now in private practice and my own practice now on Point Podiatry. And I am also at two different wound care centers here in the Valley at both Scottsdale Abrazo and Arrowhead Abrazo, and just saving lots of limbs. I see quite a few patients a week at both the wound care centers, probably about 30 to 40 patients a week at the wound care centers that span from itty-bitty wounds that don't need too much attention to massive reconstructions where I've done external fixators, 3D printed implants, intermedullary nails, massive reconstructions.
Wow. That's fairly involved, not only in terms of the foot and the toes, but also the ankle and the entire lower extremity. So I just heard your topic or your lecture here at the TED Congress on how to heal wounds.
Yes.
You know, heel wounds are probably one of the worst areas to have wounds because trying to save that limb becomes extremely difficult. How do you approach heel wounds?
Heel wounds, the very first thing I do with a heel wound is get the heel off the bed. It is always as simple as that. I get called to the hospital room, there's a wound, etc. Walk in there, and typically the patient is very limited in their mobility, and their heels are laying directly on the bed. The very first thing I do is grab a pillow and get the heels off the bed, float them. And then I go along the course of how is their blood flow, what's their blood flow, why is the heel wound there, did they just recently have a back surgery and laid in bed and now they have a wound, their blood flow's fine, getting them off their heel will get that wound on a good course, or they've had long-standing vascular issues, there's some occlusions in the arteries that need to be reopened, etc. That's my first step.
Do we have any product that keeps the heels off the bed? Because I do a fair amount of limb salvage, and then they go to a rehab or assisted living, they lay in bed, and then they get a heel wound.
Right.
And so I think heel wounds, a lot of it is education. So what kind of protective gear do we have now to keep those heels off the bed, apart from just pillows?
There are some of the heel protector boots.
Right.
They're fluffy, soft, pillow shaped that you can Velcro around the foot. Those work well if a patient can't handle laying in one place with their heels floated from the bed. They have their own issues. Anything laying in one place for too long with even the heel protector boot on can eventually lead to an ulcer. So I think that's an area where we really need to address and work on a little bit better, is better wedges, better heel offloaders.
Well, thank you, Jessica Randolph, for being here. And we look forward to having you here next year too. Thank you.
Absolutely. Thank you.